This morning, children as young as 5 years old are one step closer to getting the COVID-19 vaccine. Eyewitness News reporter Jan Carabeo joining us now from our news center with more on the FDA's decision. Jan, big news.
Janelle, good morning. Absolutely. Big news for parents looking to protect their kids against the coronavirus. About 28 million kids will be eligible if Pfizer's pediatric vaccine receives emergency use authorization.
17 voted yes, and we had one abstain.
An FDA advisory panel has given the first recommendation for Pfizer's smaller dose COVID-19 vaccine for children 5 to 11 years old.
At one point, we thought if we vaccinated enough people that the virus would go away. It's not going away, and I think we're going to have to find a way to live with it. And I think the vaccines kind of give us a way to do that.
A CDC panel will weigh in next week, and it's possible shots could be going into young arms just a few days after that.
We don't want children to be dying of COVID, even if it is far fewer children than adults, and we don't want them in the ICU.
The group of experts determined that the benefits outweigh the risks, which include myocarditis. 0 cases of the rare heart condition were found in the study. More than 6 million American children have contracted COVID. Still, some parents are split on whether their kids should get the shots.
I think it's a good idea because everybody can be safe.
I think that they're just too small, and this is something that's just too new.
Dr. Jennifer Korn at Hatboro Pediatrics in Montgomery County hopes parents turn to her rather than online.
I never mind the questions. I never mind the concerns.
In the meantime, she says her vaccine center is already pre-booking Pfizer appointments for kids ages 5 to 11. She says she's trying to stay ahead of the rush.
Right now, we are staffing. That's what we're doing. So we're gearing up for the quantity, and we're trying to add more hours. I think the main thing is this vaccine is really a chance for children to join the world again and to return to normal life.
This is the first in a multi-step process. Again, the next step is that the full FDA has to make its recommendation, then a CDC panel, and then the final authorization for the pediatric vaccine would come from the head of the CDC early next week. We'll keep you up to date, but we are inching closer to a finish line here. Live in the News Center, Jan Carabeo, CBS 3 Eyewitness News. Jim.
Thank you, Jan. Appreciate it.